How to pass NHA Medical Assistant exam. Question 1. A provider requests a medical assistant to perform a visual acuity test on a patient using a Snellen chart. How far away from the chart should the patient stand? Option A 10 feet. Option B 15 feet. Option C 20 feet. Option D 25 feet. The correct answer is option C. 20 feet. A Snellen visual acuity test is typically performed with the patient standing 20 feet from the chart. Shorter distances require specially calibrated charts or mirrored setups. Question 2. While performing a standard 12-lead EKG, where should the medical assistant place the electrode for lead B4? Option A 4th intercostal space, right sternal border. Option B 4th intercostal space, left sternal border. Option C 5th intercostal space, left midclavicular line. Option D horizontal level of B4, left anterior axillary line. The correct answer is option C. 5th intercostal space, left midclavicular line. Lead B4 is placed at the 5th intercostal space at the left midclavicular line. The 4th intercostal spaces at the sternal borders are V1 and V2 sites. Question 3. Which of the following steps must a medical assistant perform first when encountering a chemical spill in the laboratory? Option A mop up the spill with paper towels and toss them in the regular trash. Option B consult the safety data sheet, SDS, for specific cleanup and safety instructions. Option C pour water over the chemical to dilute it quickly. Option D evacuate the entire building immediately blank. The correct answer is option B. Consult the safety data sheet, SDS, for specific cleanup and safety instructions. The safety data sheet should be consulted first because it provides chemical-specific hazards, PPE, and cleanup instructions. Diluting or wiping the spill without guidance can worsen exposure or reactions. Question 4. A medical assistant is preparing a patient for an EKG. Which of the following leads are considered the bipolar limb leads? Option A V1, V2, and V3. Option B ABR, ABL, and ABF. Option C leads I, 2, and 3. Option D V4, V5, and V6. The correct answer is option C. Leads I, 2, and 3. The bipolar limb leads are leads I, 2, and 3 because they measure electrical differences between two limb electrodes. ABR, ABL, and ABF are augmented unipolar limb leads. Question 5. Which of the following structures serves as the primary pacemaker of the heart, initiating the normal electrical impulses? Option A atrioventricular, AB, node. Option B bundle of His. Option C Purkinje fibers. Option D sinoatrial, SA, node. The correct answer is option D. Sinoatrial, SA, node. The sinoatrial node is the heart's primary pacemaker and normally initiates each impulse. The AV node delays conduction before impulses pass to the ventricles. Question 6. Which of the following terms refers to the absolute legal right of a patient to make autonomous decisions regarding their own health care and medical treatment? Option A beneficence. Option B non-maleficence. Option C justice. Option D autonomy. The correct answer is option D. Autonomy. Autonomy is the patient's right to make informed decisions about personal health care. Beneficence means acting in the patient's best interest, but it does not define decision-making authority. Question 7. Which of the following steps is the correct sequence for applying personal protective equipment, PPE, when multiple items are required? Option A gloves, gown, mask. Option B gown, mask, gloves. Option C mask, gloves, gown. Option D gloves, mask, gown. The correct answer is option B. Gown, mask, gloves. The correct sequence for applying multiple PPE items is gown first, then mask or respirator, then gloves. Gloves are placed last so they cover the gown cuffs. Question 8. A medical assistant is preparing to apply EKG electrodes to a patient who has a significant amount of chest hair. Which of the following actions should the assistant take? Option A. Apply the electrodes directly over the hair using extra adhesive tape. Option B. Shave or clip the hair at the electrode placement sites after obtaining patient consent. Option C. Place the electrodes on the patient's back instead of the chest. Option D. Wipe the hair thoroughly with alcohol and place the electrodes while wet. The correct answer is option B. Shave or clip the hair at the electrode placement sites after obtaining patient consent. Hair can prevent firm electrode adhesion and distort EKG tracings, so the assistant should clip or shave only the required sites after consent. Applying electrodes over hair often causes artifact. Question 9. Which of the following sections of the patient's medical history includes information about the health status of the patient's biological parents and siblings? Option A. Social history. Option B. Past medical history. Option C. Chief complaint. Option D. Family history. The correct answer is option D. Family history. Family history documents the health status and conditions of biological relatives, including parents and siblings. Social history focuses on lifestyle factors such as occupation, tobacco use, and alcohol use. Question 10. Which of the following schedules of controlled substances contains drugs that have a high potential for abuse, no currently accepted medical use in the United States, and a lack of accepted safety for use under medical supervision? Option A. Schedule I. Option B. Schedule II. Option C. Schedule III. Option D. Schedule B. The correct answer is option A. Schedule I. Schedule I drugs have high abuse potential, no accepted medical use in the United States, and lack accepted safety under medical supervision. Schedule II drugs have accepted medical uses but high abuse potential. Question 11. A medical assistant is preparing to administer an intradermal injection for a tuberculin skin test. Which of the following needle gauges and lengths is most appropriate? Option A. 25 to 27 gauge, 3/8 to 5/8 inch. Option B. 21 to 23 gauge, 1 to 1.5 inches. Option C. 18 gauge, 1 inch. Option D. 29 gauge, 1/2 inch. The correct answer is option A. 25 to 27 gauge, 3/8 to 5/8 inch. A tuberculin skin test is intradermal and commonly uses a 25 to 27 gauge needle that is 3/8 to 5/8 inch long. Longer, larger needles are used for deeper injections. Question 12. A medical assistant is reviewing a billing claim and needs to apply a code that describes an office visit for an evaluation and management (E/M) service. Which of the following code sets should the assistant use? Option A. ICD-10-CM. Option B. CPT. Option C. HCPCS Level 2. Option D. DSM-5. The correct answer is option B. CPT. CPT codes describe procedures and services, including evaluation and management office visits. ICD-10-CM codes report diagnoses, signs, and symptoms. Question 13. A medical assistant needs to calculate a patient's body mass index, BMI. Which of the following pairs of measurements are required for this calculation? Option A. Waist circumference and hip circumference. Option B. Height and weight. Option C. Age and weight. Option D. Chest circumference and height. The correct answer is option B. Height and weight. BMI is calculated from height and weight. Waist and hip circumference are used for body fat distribution measures, not BMI. Question 14. A patient presents with a laceration on the forearm. The medical assistant notes that the bleeding is bright red and spurts in sync with the patient's heartbeat. Which of the following types of bleeding is occurring? Option A, capillary. Option B, venous. Option C, arterial. Option D, internal. The correct answer is option C, arterial. Bright red blood that spurts with the heartbeat indicates arterial bleeding due to pressure from the arterial system. Venous bleeding is usually darker and flows steadily. Question 15. Which of the following government agencies enforces standard precautions and regulations to ensure a safe and healthful working environment for healthcare employees? Option A, FDA. Option B, CDC. Option C, OSHA. Option D, DIA. The correct answer is option C, OSHA. OSHA enforces workplace safety standards, including bloodborne pathogen requirements and safe clinical practices. The CDC issues guidance but does not enforce workplace regulations the way OSHA does. Question 16. A medical assistant notes a patient has a history of dyspnea. The assistant should understand that this term translates to which of the following clinical observations? Option A, difficulty swallowing. Option B, rapid breathing. Option C, difficult or painful breathing. Option D, absence of breathing. The correct answer is option C, difficult or painful breathing. Dyspnea means difficult or painful breathing. Dysphagia means difficulty swallowing, which is a different clinical term. Question 17. Which of the following microsampling collection tubes contains the additive sodium heparin? Option A, lavender microtainer. Option B, green microtainer. Option C, red microtainer. Option D, gold microtainer. The correct answer is option B, green microtainer. Green microcollection tubes contain heparin, including sodium or lithium heparin depending on the manufacturer. Lavender microtainers contain EDTA. Question 18. A medical assistant is instructing a patient on how to collect a 24-hour urine specimen. Which of the following instructions is correct? Option A, save the very first morning void on day 1 and collect all subsequent urine for 24 hours. Option B, discard the first morning void on day 1, note the time, and collect all urine for the next 24 hours including the first void of day 2. Option C, keep the specimen container at room temperature next to a heating source. Option D, stop drinking fluids for the entire 24-hour collection period. The correct answer is option B. Discard the first morning void on day 1, note the time, and collect all urine for the next 24 hours including the first void of day 2. For a 24-hour urine collection, the first morning void is discarded, the time is recorded, and all urine is collected for the next 24 hours including the next morning's first void. This creates an exact timed collection. Question 19. A medical assistant is reviewing a laboratory report and notes a potassium level of 2.2 milliequivalent/L. Which of the following actions should the assistant take immediately? Option A, file the report in the patient's electronic health record for the provider to see later. Option B, schedule the patient for a routine follow-up appointment in 2 weeks. Option C, notify the provider immediately because this is a critical value. Option D, call the laboratory to complain about a typo on the report. The correct answer is option C. Notify the provider immediately because this is a critical value. A potassium level of 2.2 milliequivalent/L is critically low and may cause dangerous cardiac dysrhythmias. The provider must be notified immediately rather than filing the result for later review. Question 20. When sorting and prioritizing incoming mail in a medical office, which of the following items should the medical assistant place at the very top of the stack for the provider? Option A, diagnostic reports with critical abnormal findings. Option B, medical journals and advertisements. Option C, personal letters addressed to the office manager. Option D, standard pharmaceutical samples and brochures. The correct answer is option A. Diagnostic reports with critical abnormal findings. Critical abnormal diagnostic reports require immediate provider attention because they may affect urgent patient care. Journals, advertisements, and routine brochures are lower priority office items.